Good evening, everyone, or good morning or good afternoon, depending on where you are. I think we have people coming in now, so we'll be shortly getting started with the event for today. I hope I'm audible and hope everyone is doing well. So quickly, before we start the proceedings for the event, I would just like to introduce the context of why we are here, mainly the scientific poster competition that we are hosting, along with the support of the Food and Agriculture Organization of the United Nations, and with our other local partners. So quickly introducing the competition to everyone here. We are gathered here today as a part of the scientific poster competition, Farm Without Harm, Reducing the Need for Antimicrobials. We are organizing today's virtual interactive youth dialogue for all potential participants with inputs from AMR and One Health experts. My name is Vishal Philip, and I'm a consultant with React Asia Pacific. The scientific poster competition, Farm Without Harm, Reducing the Need for Antimicrobials, is being run with the support of the Food and Agriculture Organization of the United Nations, React Asia Pacific, ASPIC Clubs, Indian Association of Preventive and Social Medicine, and the International Veterinary Students Association, India chapter. The competition is open to students in the Asia region. Participants are invited from medical, veterinary, dental science, applied sciences, environmental, social sciences, and art backgrounds. The focus of the competition is to bring out innovative solutions for reducing the need for antimicrobials in food production. 3 best scientific posters selected by a jury of experts will be given prizes and will be announced as the winners. The last date for submission of the posters is 20th August 2022. For more details, participants can visit our website www.aspic.in and you can register for the competition there. So as a first step to this, today we are organizing this interactive dialogue. The participants have been provided with background reading materials for understanding the context of existing agri-food systems. Further to this, we hope that today's sessions would help you in further conceptualizing your innovative solutions for the competition. I take this opportunity to welcome all panelists, participants, and our partners to the event today. Looking forward to the discourses and deliberations. Please note that the event today is being recorded for documentation purposes. So now, without further delay, I would like to invite Mr. Satya Shivaraman, the Communications Coordinator of React Asia Pacific, for starting the event with the panel discussion and introducing the panelists. Over to you, Mr. Satya. Thank you.
Thank you. Thank you very much, Vishal. As you have already explained, this is primarily a virtual dialogue for participants who will be joining the scientific poster competition. And the theme of the competition is Farm Without Harm and how to reduce antimicrobial use in food and agriculture production. And today we will start with a panel discussion from experts from the FAO, from REACT, and from the veterinary sciences. The panel discussion theme is antibiotic use in agriculture, food and agriculture, the problems and challenges. And today we'll have with us 4 panelists. I'll be moderating the discussion, but we'll have 4 panelists. One is Dr. Emmanuel Kabali from the Food and Agriculture Organization of the United Nations, who is the AMR Project Coordination and Technical Support Consultant at FAO. He has a background along um, many years of experience, many decades of experience in practicing veterinary medicine, but he is specialized in One Health, multi-sectoral collaboration and public health research. As we go along, for the participants, young participants who are here with us, the discussion will dwell upon what exactly is meant by One Health, because that is the overarching concept which we'll be sort of discussing at the core. Our other panelist today is also from the Food and Agriculture Organization, Dr. UQ, who is the Animal Health Officer at FAO. She has specialized in infectious disease surveillance and control, biosecurity, and she is the antimicrobial use pillar lead of the FAO AMR action plan for 2021 to 2025. Then we have on the panel Dr. B. Sunil, who's Professor and Head, Department of Veterinary Public Health, Kerala Veterinary and Animal Sciences University. He has over 30 years of research and teaching experience, and he's on many professional bodies across India and globally also. And his areas of interest include One Health, food safety and quality management, and management of zoonosis and AMR. Next, we have on the panel Dr. Philip Matthew, who is a public health consultant with REACT Asia Pacific, and is also currently the AMR advisor at the International Center for Antimicrobial Resistance Solutions. So primarily what we will discuss today, I'll just put up a few topics, but I mean, we had the topic of antibiotic use in agriculture. By agriculture, we mean both livestock production and also crop production. Because while generally people have an idea that antibiotics are used in livestock, not so many people know about how antimicrobials or antibiotics are being used today in plant production, also quite a large scale, particularly in Asia. We'll come to that later. But some of the questions I wanted to sort of throw open to our expert panelists today are: what is the extent of antimicrobial use in livestock farming and crop production currently? From the data that we have, something like 3/4 of all antimicrobials used globally is used in agriculture today, livestock and crop production. That is massive. It's much, much more than what is used in human health. Another question is, why should we reduce antimicrobial use? What is the problem with antimicrobial use? Obviously, there are issues related to antimicrobial resistance, but our experts will talk more about that. With a growing global population and meat consumption in particular that requires intensive farming, is it possible to reduce antimicrobials without affecting food production? What are the key factors that drive antibiotics or antimicrobials use in farming? How can a value chain analysis of farming operations help us identify what are the best points for intervention to reduce antimicrobials? Let me start with Dr. Emmanuel Kabali of the FAO to tell us more about what is the extent of the problem that we are looking at. How big is this problem of antimicrobial use? Why is it a problem?
Good evening, colleagues, and those on this side of the world, it's probably good afternoon. Thank you very much, Satya. It's really a privilege to be joining you here, and I hope you can hear me well. It's interesting when we look at the problem of AMR and antimicrobial use in animals. And I know in a keynote a presentation coming up later, we're going to get more detail. But there are so many more animals in terms of biomass compared to humans on Earth. The actual total number of food-producing animals is actually not known. There's no one who would tell us an exact figure. But we are many tens and hundreds times more in population of animals than humans. And therefore, when we look at the volume of antimicrobials that are used in animal production, and then beyond that in crop production, the volumes are alarming. I think 70 to 73% are commonly published and talked about. But when you compare to the volume of animals that we have on Earth right now, and on top of that, we look at the volume of animal consumption per year, meaning the more animals are born, there are more that are slaughtered. And therefore, that number is fluctuating. So it's quite a massive issue. For us, the core of the issue is that food production is a key mandate for the Food and Agriculture Organization. Our main theme and main aim is to reduce hunger and to improve livelihoods. But in our bid to reduce hunger, and the population of the world is growing so rapidly, there comes the challenge of how best can we produce food in a more economic and cost-effective way, because food is expensive and generally life is expensive. So the challenge is the fact that we have so much demand for food. And then we need to find innovative ways to produce these volumes. Unfortunately, some of the methods that have been applied over time are not so prudent. And specifically in intensive farming, the use of antimicrobials may have become an easy way out of certain other requirements and practices related to animal production. And I think I'll stop there because we are going to have to discuss in a bit more detail within the context. But your question is, how big is the problem? It's quite a massive problem, because the big challenge is to provide the food that is needed in a cost-effective way, but also that food needs to be produced. And that is where the real issue sits in this case. Thank you for now, Satya.
Thank you, Dr. Kabali. Next, I will turn to Dr. Sunil to tell us more about what exactly is the problem. I mean, as Dr. Kabali said, you have a massive number of food animals on the planet in terms of biomass and in terms of numbers, and we need to produce food. So you have to use antimicrobials, or antimicrobials have been used in food production for decades now. Why exactly is it an issue of concern today? Why should anybody be bothered about this?
Thank you, Satya, for this invite, and glad to be amongst the participants for this virtual interactive dialogue. And it's extremely nice to be with Dr. Kabali and Dr. Yu also, and Dr. Philip. As Kabali has rightly nailed the point at the outset, because food production is extremely important when we are talking of meeting the requirements of the population, which we are projecting probably 2030, 2050, and things like that. Probably we are looking at doubling the production or maybe tripling it so as to meet the requirements. So given that state of affairs, we are forced to go into an intensive system of production, especially in the livestock sector. And antimicrobial drugs, whatever it is, whether it is antibiotics or other drugs, have been used in animals raised for food production systems. And as Dr. Kabali was saying, the use and the presence, given that you have an antibiotic at hand, has become an easy way out to get out of some of the other stringent management practices which the livestock or the animal husbandry sector demands in farming systems. And this, mainly the antibiotics, they have been used for treatment of the animals and for control, prevention of diseases, and unfortunately for growth promotion as through increasing the feed efficiency, because the advantages of using these antibiotics, in addition to preventing this prevention and mortality, morbidity, and the most importantly, as far as Dr. Kabali was saying with regard to the livelihoods, it reduces significantly the input costs, especially through the feed efficiency. So this is one of the reasons why antibiotics have been used in large amount in the livestock sector. And given this state of affairs, I think this is probably one among the many reasons why we are looking at, antibiotics in livestock sector as an important driver in promoting antimicrobial resistance in the pathogenic organisms. I think I'll stop at that, Satya.
Thank you so much, Dr. Sunil. For some of our participants who may not all be from a medical or veterinary background, antimicrobial resistance or antibiotic resistance is primarily the phenomena where the bacteria which cause disease, pathogenic bacteria as they're called, we use antibiotics typically to neutralize them or kill them when an animal or a human has a disease. Antibiotic resistance is a phenomena where the bacteria, the antibiotic no longer has an impact on the bacteria, and the bacteria survive in large numbers and become resistant or become stronger. So the antibiotic no longer works, and obviously there's a treatment failure. So this is a huge problem globally. In 2019, according to the latest figures that we have, something close to 1.27 million people around the world died due to antimicrobial resistance being the major factor behind their deaths. That is a huge number. To put it in perspective, 1.27 million people dying in 2019 was larger than either HIV or malaria globally. So we are today talking about antimicrobial resistance not as a threat in the future, but a threat that is already here. I will now turn to Dr. Yu from the FAO again to tell us more about the threat of antimicrobial resistance and the link with food production. We have heard about the volumes of antibiotics used, but what is the kind of evidence and what is the kind of what do the studies show? How is this linked to antimicrobial resistance? And how does it affect human health also apart from animal health?
Thank you very much, Satya, for this very interesting question. And good afternoon, good evening, everyone. It's my great pleasure and honor to join you today and to have in discussions on this very important topic, the antimicrobial resistance. And as Satya just mentioned, antimicrobial resistance is now a growing concern for the entire world. So now every year, researchers have already estimated every year, at least 1.2 million people die directly due to the antimicrobial resistance. And some other co-factors may finally lead to almost 5 million deaths in the human population associated with antimicrobial resistance. And if we don't do any interventions, this number will unfortunately continue to increase. And the World Bank has estimated maybe eventually by 2050, maybe more than 10 million people will die every year directly due to antimicrobial resistance, AMR. So as also my colleague, Dr. Kabali just mentioned, currently in the world, most antimicrobials produced are used in food animal production. And there are some estimations like probably globally more than 70% or 80% of antimicrobials are directly used in this kind of industry of food animals. So the extensive use in the food animals have daily impact on the human health. Some examples, for example, like colistin, which is the last thought antimicrobial and is the highest priority CIA, critically important antimicrobial on the WHO list. And the colistin previously was prohibited to be used in human medicine because of its side effects. And then in the animal production industry, it has been extensively used. And then before its application in the human medicine as a last resort antimicrobials, resistance has already been observed in humans. In many gram-negative bacteria, the resistance was observed in many gram-negative bacteria against colistin. So this was a very strong evidence that the application of colistin in food animals can also drive resistance in humans, although those medicines before those medicines can really be used in humans. And there are some other evidence, mainly from the developed world, because they have more research, more surveillance, and more attention on the antimicrobial resistance in the previous decades. And I will not elaborate them one by one here, but I just wanted to say this evidence has already been substantial. And especially, we have seen that for many gram-negative bacteria and also like MRSA, the Streptococcus aureus, the resistance the bacterial resistance really linked between human medicine and veterinary medicine. And now there is also a growing concern that in the environment, many antimicrobial residues are detected in the city wastewater, like in sewage, and also in the natural water, like lake, and also the river. So those are also very much associated with agricultural production for both terrestrial animals and also aquatic animals. So now we are living in an environment that is increasingly contaminated by antimicrobials. A big factor is from the agricultural production. So now it's all our responsibility to take our role, to play our contribution to this very important topic. And we all need to act from now on to help prevention, to help stop the increasing trend of antimicrobial resistance and to protect public health for our future generations. Thank you.
Thank you, Dr. Yu. That was very informative about the evidence that is there that shows the link between antibiotic use in food and agriculture and antimicrobial resistance. I'll now turn to Dr. Philip from React Asia Pacific. He's a human health doctor, a physician, but also working on the larger public health issues related to AMR. If you could explain to our audience, how exactly does antimicrobial resistance move from the animal sector to the human sector? What are the different ways in which this happens? Different pathways by which, I mean, for example, if there is antimicrobial resistance in animals, why should human beings be concerned about it? Except in terms of animal health, of course. But in terms of human health, how does it matter?
Thank you, Satya, for the question, and greetings from the beautiful country of Zambia. So I think there are enough and more. There's enough and more evidence out there to show the mode of transmission between animals and humans. The resistant genes and antimicrobial residues can actually move from one system to the other quite easily, and most of it is actually mediated through the environment, I would say. In many cases, environment acts as an amplifier of resistance and also fulfills the role of a transmitter. So essentially, resistance moves from animals to humans via the medium of environment. So that is the most commonest pathway. Then there are minor pathways also showing that there is a movement of resistance directly between animals to animal handlers and to a wider human population. There is, of course, a vector-borne transmission, which has been proven in many cases. So there are several pathways of movement of resistance, and it is quite clear from all the evidence available that indeed resistance moves from one system to the other quite easily, and most of it is actually mediated by the environment. And why should we be concerned? Antimicrobial resistance is an evolving phenomenon. All the previous speakers have very eloquently mentioned about the need for controlling antibiotic use because of the larger biomass, the animal world constitutes, and the quantities of antibiotics frankly used in many of the instances, and also the kind of antibiotic used, the highest priority critically important antibiotics for human healthcare used extensively in animal side. But more than all these facts, I think we should be worried about these pathways which exist, which transmits resistance from animals to humans. Okay, and the primary drivers of these several pathways is basically lack of hygiene, or lack of biosecurity, or lack of good production practices, and all of this can actually be reflected based on the need for low, cheap food, or food produced without high quality production practices. So essentially, all these problems boil down to one area in which human intervention is essentially required, which is the lack of hygiene, the lack of proper adequate sanitation, the lack of proper biosecurity practices, which can reduce the use of antibiotics, reduce the use of infection, and also reduce the requirement for antibiotics together. So I think that should be the area that we should be focusing about. But all of this, when we are trying to advance this discussion, we should be very well cognizant about the fact that when antibiotics are used in animals, the consequences can be felt in humans. I will stop there. Thank you.
Thank you, Dr. Philip. I think that's an important point that you're raising, that a lot of antibiotics are used because the costs of using antibiotics seem to be lower than investing in better management practices, better hygiene, biosecurity, better infrastructure in farming operations. So I'll ask Dr. Kabali a question now. Is it really true that it is cheaper to use antibiotics? Or let me put it this way, suppose we stop using antibiotics or reduce it drastically. Will it increase costs of production for farmers? And whether it will also result in a drop in production? Because if the end goal is to provide food for a growing population and growing consumption, is there a tension here between reducing antibiotic use in farming and will it result in reduction of production? And the last question is, are there examples of reduction in antibiotic use which have not resulted in drop in production around the world?
Thank you, Satya. A very loaded question. I remember in your introduction, you mentioned One Health as one of my interest areas. And why I'm very interested in One Health is that it's a better approach to an issue like AMR. I think AMR is a great potent issue to be addressed using the One Health approach. And One Health, basically the major concept around One Health is that everything are interconnected. And the reason I want to raise this as I'm answering your question is the increase in cost. Are we looking at it in a silo approach as a farmer? Are we looking at it as an increase of cost back to the farmer across the entire continent? In this case, the food value chain, including the health, the health chain. Indeed, most intensive production systems, large production systems, are not only in poultry, beef production, pig production, aquaculture. Application of antimicrobials has seemed to help reduce the cost of production, reduce the cost of food. But there are sufficient studies, again, or there are studies, maybe not sufficient, but there are studies that demonstrate that use of antimicrobials, for instance, for things like growth promotion, for prophylactic treatment, for metaphylactic treatment. And because our audience is students at different levels, those are very big words. Using antimicrobials to treat an animal that is sick is the right thing to do. That should be important to understand that. Treating an animal when it is sick with the right antimicrobial, so if it's an antibiotic or antifungal, is the right thing to do, because as medical people, our role is to relieve pain ensure that there is good health, but for animals especially, there's productivity. Healthy animals produce better products mostly to the benefit of human beings. So the appropriate, correct use of antimicrobials is good. The challenge is there are those other uses which my colleagues have mentioned where we want to replace prudent, correct practices with an easy way out. The truth is the easy way out does not help, because in the bigger picture of One Health, we are creating problems and just pushing them forward. And I think Dr. Yu said, the ultimate reason we are concerned is to make our world a better place, but most importantly, to leave a world good enough for the future generation. Because at the point where we are at a point where there will be no treatment for very simple things as a fracture, a cesarean section wound, a simple wound that you get when you're walking on the beach or when you're working at home. And bacteria gets into that wound and it is not treated. And these are real problems now. People are getting amputations, people are getting eyes removed, and people are dying because there's no treatment. So the cost is there, the cost might be there, but over the bigger picture, the cost would be definitely less. And there are practical ways we would like to communicate back to the producers of food. It's important to produce the food, but let's use the right ways to produce food that will help keep health of the population, of the environment on the end of our world good. In closing, a farmer who uses antimicrobials has children and her or his family with them. The use of antimicrobials on their farm, on their animals, has implications to their own health. Keeping their animals in a very bad state, so where there's lack of biosecurity, lack of hygiene, lack of infection prevention, lack of quality water supply, is a risk to the farmer and their own family. It starts from there. So when you talk about cost, we need to look at a wider perspective than just how much does it cost to produce one cow, one pig, or one chicken, to what is the net cost to me as a farmer who is a human being, who needs healthcare, who has a family that also needs quality food and healthcare. And therefore, from that perspective, it's very easy to realize that the cost is actually less if we don't use antimicrobials. Even if production might slump a bit because you've stopped a bad practice that was helping your production, it is better because the overall cost is likely to reduce. And I'll stop there so that colleagues can also add in their thoughts. Thank you.
Thank you so much, Dr. Cavalli. I think you put the point across that ultimately you have to look at it from a One Health integrated perspective. You cannot look just at the animal sector alone in isolation. To look at the cost to human health, including that to farmers themselves. Now I'll ask Dr. Sunil a question that, there are farmers and farmers and farmers. There are different kinds of farmers, small, medium, big. Today in many countries around the world, including in India and countries which are big food producers, typically, you have very large food corporations or food producing, they call integrators, like in poultry farming, for example, who actually control a lot of the production process. And to what extent are they driving? Because if I'm a small farmer who's producing chicken on behalf of a larger company, and the company is what is telling me what are the kind of production practices I need to follow, they're the ones who are advising me on what kind of antibiotics to use. To what extent can we, because it's one thing to talk about farming in general, but if we can identify the real hotspot or the value chain, where exactly are the points in the production process where we can intervene effectively through regulation or through consumer campaigns or through awareness programs? So what would you identify as the real hotspots where focusing would help reduce antimicrobial use more effectively?
Satya, You have spoken that well. Now, with regard to this value chain, when you are talking about that, I think basically there are a lot of areas I think we need to improve in this. One probably where we could drive in is the poor farm hygiene. And basically the overcrowding, the stress which it causes. So all these things, I think this is because the stress and disease conditions are correlated. So when you have poor hygiene, when you have overcrowding stress, it definitely leads to disease conditions in the farm. And again, you are going in for an antibiotic to deal with that. So if you're able to take care of this, basically the hygienic aspect and the overcrowding, the stress, the welfare aspects, probably this could bring down the level of antibiotic usage in that particular farm. But this is not the only thing which is there. Now we are also looking at a certain lack of farmer awareness also, because they are not aware of the stress conditions in which they are, because they have been taught that, you know, this is the way in which the animals are reared. But the right method of rearing of the animals in stress-free conditions with proper hygiene and sanitation will definitely bring down the level of usage of antibiotics. And in many cases, this has also been reported and proven also. And the third aspect which I would like to flag off here is with regard to the role of the government and the industry, food industry also, because you need to have a oversight on the production systems, which we are currently lacking. You have the regulations and other things, but then the oversight and implementations of these is one which is lacking. So these three things could be flagged off. And then this coupled with the misuse of antibiotics, when you have a poor hygiene, lack of farmer awareness, and your lack of government oversight or a regulatory body for this, this could bring in the increase in the use of antibiotics, antibiotic misuse, as you call it, and this certainly creates a lot of pressure for antibiotic resistance bacteria. So selection procedure that is taking place here, and also for the resistance mechanism. Now, again, as Dr. Kabali was saying with regard to the after effects of this, the persons working in those farms. So there is a direct human exposure which is taking place in those farms, especially the occupational part of it. So there is a lack of safety measures on the farms on these counts, and coupled with a low biosecurity in the farms. So biosecurity in farms is of ultimate importance. Now, which we have not given much stress, because you have a system wherein you can use antibiotics to take care of biosecurity. Now, that should not be the way it should be going. Now, for the sake of students, I'll just quickly go through this, because biosecurity, biosafety, whatever you call it, biosecurity is the preventive measures which you take to keep the livestock free of infections. Now, this could be actions which we are taking in the farm to prevent infectious diseases getting into your herd, that is into your farm, or it could be actions you are taking to prevent infection spreading out from the farm. So in both ways, you are going to have a control mechanism on the farm. That is infection not getting into the farm, and as well as infection or any conditions in the farm getting out of the farm. So better biosecurity in the farm leads to a lower chance of bacteria to develop the resistance, a lower chance for disease process in the farm, less antibiotic usage, better production systems in terms of your animal health, welfare, and definitely this will have a lot of positive public opinion also, and ultimately profitability to the farmers. That is it from me, Satya.
Thank you so much. I'll take it forward from what you've said, but also keeping in mind that some of the questions that our participants have already sent us. Our next session is a Q&A session with the participants, the young participants asking questions, but I'm taking up on one of the things that has come up in the questions, and I'll ask Dr. Yu. Biosecurity is obviously the way to go, because it means no use of antimicrobials, prevention, basically, you're preventing disease. So if there's no disease, then you don't need antimicrobials. But the question that keeps coming up is that, are there alternatives to antimicrobials which are as effective as antimicrobials in preventing or treating disease? Like in some countries now, farmers are using, there are even pharmaceutical companies that are producing probiotics, for example, or alternatives to antimicrobials, which they claim does work. There are many things that are being suggested. Is there any kind of, do we have any kind of evidence that there are alternatives to antimicrobials when it comes to treating disease? Or even as a growth promoter, for that matter? There are some claims of some supplements that benefit the animals in terms of the growth, overall weight that they put on. Is there anything that you've come across or would suggest worth looking into? This is a question to Dr. Yu, sorry.
Thank you. Sorry, Dr. Sataya, could you please repeat your question again?
Yeah, the question is, are there alternatives to antimicrobials that can be used, other supplements, probiotics, herbal extracts? Because a lot of experimentation is happening right now, because there's a growing awareness about reducing antibiotics. So many farmers and many pharmaceutical companies are also sort of pushing alternatives. Do these alternatives work in terms of either growth promotion or in terms of treatment of animals?
Yes, this is a very good question. Thank you very much, Sataya. So to answer it shortly, yes, there are many alternatives to antimicrobials that have already been developed, or many examples have already been said by you, like the herbals and also like the traditional medicines in Asia. They have been proven effective in both human medicine and veterinary medicine, and also with industrial development like probiotics, enzymes, and also organic acids, and many other new developments have also shown to be effective in certain scenarios. And so the FAO has a report, has a publication on the FAO website. I can share in the chat later that summarize all the other alternatives to antimicrobials that could be added to the animal feed. So and also compared their advantages and disadvantages. So for the audience who have interest, you could have a look at the detailed reports published by FAO. And also, I mean, although there have been so many studies and so many developments on the industrial products, still they are compared to antimicrobials, there are still some interesting disadvantages. Because one major concern is always the performance of those alternatives are not always stable. So they can be proven to be quite effective in certain scenarios. But if they are used in another different farm environment, their effect may not be that obvious as claimed to be. So this is a bit different from antibiotics. So currently compared to antibiotics, so the instability, I mean, the unstable performance of those alternatives and also their relatively higher price still limit their wider application as alternatives, as perfect alternatives to antimicrobials. So those are still constraints, and we still need to engage the industry sectors to further have technical advancement on in this area. And meanwhile, we also know, like for the antimicrobial use, probably the most effective way is to address it from the root. So what kind of drivers they really drive the use of antimicrobials? If we can identify those drivers and we address the problems from its root, for example, like to prevent the introduction of the disease into a farm, and also try to have better management skills to reduce the stress of animals, So those in combination with the alternatives could likely to have a more obvious effect. Thank you. Yeah.
Thank you very much. And we'll be very happy if you can share that link to the FAO publication in the chat. I think that'll be very interesting for some of the participants here to read. I'll now turn to the last question in the panel discussion, after which we'll actually have questions from the participants here. To Dr. Philip, the question is this, that while government regulation, as Dr. Sunil said, you need a regulatory body, you need laws, and you need to implement. But this is easier said than done, because very often regulation doesn't work in many low middle income countries. Is regulation enough, or do we need a set of incentives for farmers? What are the kind of incentives for farmers? Why should a farmer invest in biosecurity? Because it does mean expense. I mean, many places crowded, intensive farming is happening also because space is expensive. And second, to produce, to provide all the infrastructure, proper water, air, regular hygiene, it's expensive. What are the kind of incentives that will be required to move people away from antimicrobial use in farming?
I think, Satya, you have answered the question. The challenge with changing farmer behavior is that there is no incentive for them to change their behavior. Why should, exactly, borrowing your words, exactly why should they change their behavior? It's not something which is not going, which is something going to affect them directly all the time. So we have to demonstrate the reasons why they should be changing their behavior. One. Second, they should be provided with incentives. Like, when we are talking, bulk of the food animal production across the world happens on small production facilities. These are backyard farms or smallholder farmers. So it's basically they are doing this for livelihood. And we know for a fact that use of antibiotics make this whole production process more efficient. And probably the antibiotics is the single most important tool which can make production systems more efficient. That's the reality, unfortunately. So they use it to bypass a lot of other things, including biosecurity, investment in biosecurity, use of money to improve the production practices. So all that is bypassed using antibiotics, and the whole focus is on cheap food. Make food as cheap as possible. So that's where the structural constraint in the food industry is. Our focus has always been on cheaper food and not high quality production process. And there are so many inherent injustices prevalent within the food industry. For example, if you go to a supermarket in Europe and if you go to a supermarket, say in India, the food prices, the prices of food are almost equal. When the average per capita income in India is probably 5 times lower than that in Europe. So why should a high income country pay the same money for food as a low income or a lower middle income country? So the inequities or the structural anomalies start from there. And the unfortunate situation is, for all these structural anomalies, we finally end up blaming the farmer, who is actually there for his livelihood. So the solution for all of these issues primarily starts from incentivizing better production practices by smallholder farmers. These incentives need to be monetary. A lot of people have talked about other kinds of incentives, but it's finally the money, it's finally the food on the table which matters to a smallholder farmer. So that incentive can be in terms of conditional cash transfers, subsidy programs, assistance to improve biosecurity, expert advice available to people. It can be in various different sizes and shapes. But the fact is, we have to support the smallholder farmers and not lay the responsibility on them and victimize them for the structural issues that are affecting the whole food production system, which are indirectly increasing the demand for cheaper food and thereby increasing the use of antibiotics in food production. Over.
Thank you very much, Dr. Philip. That was very clearly put, that it's ultimately about the money involved, and it is unfair, perhaps, to put all the burden on just particularly the small farmer. We will actually now move seamlessly from this panel discussion to the Q&A session, where a lot of our participants have asked very interesting questions. Unfortunately, we won't have time to go through each question one by one, but I'm going to summarize some of the questions that have come up and paraphrase them. One question which has not been explicitly asked, but it is implicit there, is from a consumer point of view. See, one of the things that has happened in many developed countries already is that there are big consumer campaigns for making sure that the meat that they are consuming, like chicken, poultry, for example, in the US, that it be antibiotic-free chicken. And the consumer campaigns have been quite effective in forcing some of the biggest poultry suppliers or even big food chains like KFC or McDonald's and so on, or Tyson Foods in the US, for example, to ensure that the chicken that they're procuring for sale to the consumer does not contain any antibiotic residues. I want to ask this question to any of the panelists who would be able to answer this broadly. Do these kind of consumer campaigns help? How much weight should we give to consumer concerns about antibiotic residues coming through food onto the table? Because the farmer is ultimately, any farmer, small or big, depends on the consumer for a market. And if consumers put pressure, they'll have to change behavior whether they like it or not. So there is a cycle here, positive cycle here. It could be like an economic incentive or disincentive. For example, chicken that is marked as antibiotic-free chicken sells at a slight premium over other chicken. There are countries where farmers are being helped to market their products, produce antibiotic-free chicken and sell it at a higher price. So there is an economic incentive coming from the market. So it doesn't require subsidies from the government all the time. Consumers can probably build a movement with which you can change behavior. Dr. Kabali, would you like to take this question?
Oh yes. No. Let me try to have a go. Dr. Sunil said something that I noted here, and he said positive public opinion. And Dr. Yu also mentioned about addressing this problem from the root. And I think the consumer is one of the critical roots around this, because not only farmers, not only animal producers, generally sellers, providers of goods and services are very sensitive to customer demands. And specifically in farming and animal production, AMR is not so much a problem to the farmer, because if the medication is not working to treat an animal, they've got the option of taking the animal for the slaughter, for instance, before it's time. So if the consumer demand that this is what we want eggs that are antibiotic free, we want meat that is antibiotic free, the farmer will have no option but to respond. The farmer will have no option but to respond, because if you don't respond, then you're out of the market. It is a very difficult thing to do, but in my opinion, and I think also from the FAO point of view, is a very critical medium to long-term approach. Besides other things like food demand, other things like reducing the food losses and waste, because in our consumption of food, we waste a lot of food. And sometimes the demand for meat is quite excessive and we can reduce those. But most practical, if we can get to the consumers to demand and put pressure, the producers will always look for what Dr. Sunil said, a positive public opinion. And the consumer's opinion is a very critical opinion. I feel that is one of the several alternatives to antimicrobials, because if the consumer will change their demand from a low price to the right quality of food. Because remember, in the cost, you can buy food that is cheap and then spend more money in hospital bills. And when you go to the hospital, you may be infected with a resistant bug from the food, and therefore you even spend much more. So if we can get the consumer to understand that quality food, food of good quality, benefits them and they have a right to demand for it, we are likely to be making much more headway in this regard. And I hope my colleagues can also add on to that. Thank you.
Thank you very much, Dr. Kabali. Anybody else would like to add to what Dr. Kabali has said about the role of consumers? And one of the questions that has come, I'll just ask one of you.
Satya, can I just add to that what Dr. Kabali was saying with regard to that? And just a point which I would like to add, because what I've seen is in Australia, there is what is known as this National Medicine or Drug Policy, wherein they are looking at a policy involving the community as a cornerstone for usage of drugs, and then with regard to their benefits, conveying the benefits, what are the side effects to the consumer. And they also say that the drugs have to be used judiciously, appropriately, with safety, and also with regard to the efficacious use of these drugs. Now, consumer medicine education is part of this. Now, consumers are educated on, like, you can ask your doctor or a pharmacist as to what exactly is the medicine which you are taking, what are the risks, what are the side effects, and the consumer info is available for that particular drug or the medicine or an antibiotic. Now, on similar lines, we could also think of educating our farmers, because the farmers need to know what drugs are being used, what they are using on the farm animals. And if they get to know the side effects, the other side of it, probably they'll be more aware, and then start thinking twice before jumping into this injudicious use of antibiotics. That's it from me, Satya.
If I can ask a follow-up question to you, Dr. Sunil.
Yes, please.
How aware are farmers of what are the kind of antibiotics that they are used? Many of these antibiotics are mixed in the animal feed that they're getting. Many of them, I think some surveys have been done, many of them don't know that they're using antibiotics. So probably the focus of the campaigns or the regulation should be on the animal feed manufacturers who are mixing antibiotics in many parts of the world.
Absolutely, absolutely. I think feed is the one which is now getting into the regulation. The BAS is there. You need a BAS certification now in India. And also the FSSA, the Food Safety and Standards Authority, is also looking at animal feed. And they are also coming out with the standards for that. Probably that regulation, I think probably in course of time will take care of that.
Okay. I'll ask one last question, which is to Dr. Philip, to tell us quickly about the Antibiotic Smart Community Project, which is somewhere along the lines of what Dr. Sunil was talking about, and Dr. Kabali also mentioned about awareness in the community. Just because it's a novel initiative, which is, at an early stage, but you could tell the audience about what you're doing in Kerala, for example, with the antibiotics.
Yes. So thank you, Satya. I think I will quote Dr. Yu, who was mentioning that the driver, we need to be cognizant about the drivers of antibiotic resistance, not trying to kind of contain it at a later stage. Go upstream and find out what are the real drivers of antibiotic resistance. And if you actually look at this issue, many of the drivers actually lie within the community setting. We have a perception that antibiotic resistance is always controlled by professionals, as in the use of antibiotics within healthcare environments or in veterinary centers, but that's not always the case. If you look at hygiene as a driver for antibiotic resistance, use of antibiotics in farm context, or even issues around access to medicines, all of that has a strong community component, which we often ignore in action plans. So our initiative was to create a narrative and a model for engaging community groups, or rather community stakeholder groups, on the issue of antibiotic resistance? And can we work out a set of programs that we can implement within the community setting to tackle the issue of, or rather, to contain the issue of antibiotic resistance? So that was the mandate of Antibiotic Smart Communities project. So in short, we selected a small community, small 14,000 population strong community in the state of Kerala. And we've been working with them for the last 4 years. One of the components of the project was to develop an indicator framework by which we can measure the so-called antibiotic smartness of a community, and also frame an action agenda by which we can define a set of specific actions which can improve the drivers of antibiotic resistance within the community. In short, that is it. Over.
Thank you so much, Dr. Philip. I think we're running out of time for the Q&A session. But just one point I wanted to make was all the questions that have come in from the participants, we will actually, I would encourage the participants not to be anonymous, put their name so that we can get back to them directly if it's possible. But anyway, what we will do is we'll take all the questions that have been asked, because all the questions are important. We don't have time to specifically answer, but we'll put up the answers on a website or a folder which is accessible. So please do follow up. If your question has not been answered, they will be answered, and we'll send a link to all the people who have registered here so that we can keep this discussion and dialogue going. But I'll have to end this session here, the panel discussion and Q&A session, and hand it over to Dr. Yu to make a presentation on a very, very ambitious and very long-term 10-year project FAO is launching, a global campaign on how to improve, how to create healthier food systems and reduce antimicrobial use globally. So I invite Dr. Yu to make a presentation now. Over to you, Dr. Yu.
Thank you very much, Satya. Can everybody see my screen?
Yes, it's visible.
Okay, thank you very much.
Yes.
Yes. So can everyone see my screen? Is everything okay?
Yes.
Okay, thank you. Yeah. So it's my great pleasure to take this opportunity to present to you about FAO's initiative to launch a global campaign for reducing the need of antimicrobials for healthier agri-food systems. So just some background information. So as we know, since 1950s, after the Second World War, the human population is increasing steadily, especially in Asia, as the blue parts in the bottom of the chart. And in accordance, the global meat production also increased significantly since the Second World War, as you can see from the chart on the right side of the slide. In accordance with the increasing human population and also the meat production, the use of antimicrobials in agriculture, especially in the food animal production, also increased steadily. And now, according to a study published in 2019, 73% of all antimicrobials sold globally are used in animals raised for food. And if we have a closer look, especially for the intensified production systems, for example, like pig and also chicken, they consume the most part of the antimicrobials in the agricultural sector. And also we can see that the consumption of antimicrobials in the agriculture and also in cattle are also unnegligible. They are also quite a proportion there, although a bit smaller compared to pig and chicken. So here there are some numbers that are very impressive. For example, like over 93,000 tons of antimicrobials used in animals in 2017. And 42 countries in the world in 2017 still use antimicrobials for growth promotion. And 76% of antimicrobials commonly used in food animals are also important in human medicine. Up to 80% of antibiotics consumed by animals are excreted, non-metabolized into the environment. And on this slide, I want to present the increasing trend of intensified production for food animals. So as you can see here on the left side of the slide, for cattle and also ruminants, and also especially for cattle, beef cattle, dairy cattle, pig, and also chicken, the intensified production is increasing quite significantly. And the landless production system now is the most important contributor for food production for pig and poultry. And on the right side of the slide, you will see in accordance with the intensified production of pig and poultry, the antimicrobial use in pigs and poultry chickens are also much higher as compared to cattle, which is relatively less intensified produced. So those figures can be observed both in OECD countries, developed world, and also in developing countries, for example, like Vietnam. And so we have seen the increasing trend of antimicrobial use in the world. And in line with that, we also observe the global trends in antimicrobial resistance in animals in low and middle income countries are also increasing steadily. So from the previously published data, it was estimated that from 2000 to 2018, the proportion of antimicrobials showing resistance to more than 50% of tested antimicrobials increased from 0.15 to 0.4 in chicken, and from 0.13 to 0.34 in pigs. So all almost tripled. And on this slide, we can really see that the social context for the increasing use of antimicrobials and the increasing trend of AMR. So we have the increased human population, which of course have increasing food demand. And with the increasing food demand, we are using more advanced technology to have intensified production of animals. And with the intensified production, we also tend to use more antimicrobials because those animals, they are raised in high density and always in a very stressed environment. And also the risk factors for disease introduction and spread within the farm is also very high if the biosecurity is not properly implemented. And antimicrobials in those farms can play a very important role to promote growth, to prevent disease, and also to control disease once it is introduced. And with all those increasing use of antimicrobials, eventually we can see the increased trend of AMR. So as a consequence, we can see there are many studies to estimate the socio-economic impact of AMR, the reduction of the GDP, and also the health inequality, and also many more people will come into extreme poverty if AMR is left uncontrolled. And eventually the health coverage, universal health coverage, will become more and more difficult to achieve. So with the FAO's initiative, now we would like to take the platform of the FAO One Health umbrella to promote a global campaign to reduce the need of antimicrobial use for food and agricultural systems. So why we want to promote reduce the need, as we have discussed before, if we just look into the AMR, which is really the consequence and the downstream of antimicrobial use, probably it's already too late to give needed interventions. If we look into the upstream, which are the drivers of using antimicrobials, and then we design and implement effective interventions, eventually we can also have long-term and probably more cost-effective impact for the downstream activities and AMR. So for the global campaign, we will impulse a wide selection of stakeholders, for example, like food, agricultural business people, and also research institutions, national governments, consumers, research academy world, and also farm, civil society. And under the campaign, other activities will be mainstreamed under 4 main pillars: political and advocacy. We need to further increase the awareness and the political commitment to control AMR at the very high political agenda. And we also still need to continue the technical advancement to prevent and control disease, for example, like use vaccines, and also to promote animal husbandry skills, techniques, and better nutrition schemes, for example, like alternatives to antimicrobials in the feed, which I saw the link of the FAO report has already been shared from the nutrition perspective to compare the advantages and the disadvantages of different alternatives to antimicrobials. And of course, we need to have resource partners' contribution to support countries in need to mobilize, to establish infrastructure to make effective interventions. And we also need a strong partnership worldwide. For example, like now we are collaborating with REACT to have this kind of regional dialogues, to engage with you, to talk about the shared concern, and to brainstorm together what could be the most effective solutions. So on this slide, I would like to emphasize that the global campaign to reduce the need of antimicrobials is really a One Health approach. So we can see that by reducing the use of antimicrobials in the agri-food system in both animals and plants, eventually the environment will be less contaminated by antimicrobials, and the health of animals, plants, and humans will all be protected and strengthened. So how to achieve those? There could be many examples of key interventions. For example, like vaccine, we need to pay more attention and more investment to vaccine development and to improve vaccine accessibility to all types of farms. And also we need to guide farmers to do the post-vaccination monitoring to continuously monitor the field effectiveness of vaccines. And also we still need to invest more on developing the effective alternatives to antimicrobials, like the feed additives, the bacteriophage, and the traditional medicine. And also we need to establish the surveillance system for AMR and AMU at both national and farm level. So we can really benchmark which type of farms they are really very advanced in reducing the use of antimicrobials, and which type of farms they are very much lagged behind in and still use large amounts of antimicrobials compared to their peers. And also the behavior change, we need to identify the incentives and the disincentives of farmers and the stakeholders to change their behavior on antimicrobial use. And also for the farm, at the farm level, we need to strengthen biosecurity, for example, like through agri-wash, through agri-IPC, the infection prevention and control IPC. And we also need to help farmers to adopt a good management for the farm, including the production techniques and the nutrition schemes. And we also need to help veterinarians to increase service, to improve their service to farmers through better vaccination, through better capacity building and better veterinary performance. So all those are really built under the National Action Plan for AMR. And the FAO has the tool called the Progressive Management Pathway for AMR, which is really helping countries at the national level to evaluate the progress of implementing the National Action Plan on AMR. And in addition to those examples, we also listed a few cross-cutting components, which are also very, very important, like innovation research, and also collaboration and coordination, advocacy, and partnership. So here, show you the different levels of intervention at the farm level to reduce the need of antimicrobials. It can be achieved through biosecurity, vaccination, nutrition, husbandry, and health services. And at the national level, we need to have a better enabling environment. We need to have better engagement with all the stakeholders and have a really strong and effective legal framework. And also need to provide trainings and capacity buildings to farmers, to veterinarians, and to other service providers. And we still need to continue our efforts to improve awareness and advocacy. Now we have this kind of youth engagement, which is part of the great effort to improve awareness and advocacy in the country and in the region. And also we need to further promote data sharing. We need to monitor where are the hotspots of AMR and AMU, and then the interventions can be directed there. So at the international level, the FAO is in active collaboration with OIE, the previously the World Organization for Animal Health, previously called OIE, now WOW, and also WHO, and also the UN Environment Program, UNEP. And also within FAO, we are also collaborating with the national governments through, for example, like the farmer field schools, which my colleague Emmanuel Calavi is very familiar with, and he has led many farmer field school activities in Africa with great achievement. And also FAO's in-farm system is really to support AMR and AMU data collection and sharing. And also about the surveillance and monitoring, the FAO Atlas tool is to help countries and laboratories to build capacities to do the susceptibility testing for antimicrobial resistance. And also the FAO PMP tool, the progressive management pathway for AMR, and also the tracks is really to evaluate countries' progress along the national action plan. So those are the tools that are available at the international level to support countries to have a better enabling environment for reducing the need of antimicrobials. And within the campaign, this is a very brief structure. So we have the management level. The activities will be led by the coordination team at FAO headquarters with close collaboration with other quadripartite partners. And at the country level, we will have the national action plan, capacity building. And also at the farm level, we will have some key activities really help farmers to drive ground level changes. And we also have some cross-cutting components to help all those activities at different levels. So within the campaigns, the expected achievements including, for example, like we want to have 100 countries participate in this campaign and have the national action plan for AMR fully implemented in the agri-food sector. And also we aim to achieve 30 to 50% reduction of antimicrobial use in all the food and agriculture sectors. We want to reach 1 million farms within the campaign to help them reduce the need of antimicrobial use. And also we want to train at least 10 million animal or plant health workers to build capacity for them to provide better services and to reduce the use of antimicrobials. So the expected benefits, we are expecting the health benefits, as you see from the chart here, from the estimation of the World Bank. By 2050, it was estimated that 10 million people every year will lose their lives due to AMR, and we want to reverse it. And about the food security benefits, so if the AMR problem continues, more and more disease will become untreatable, and the mortality and the morbidity of of animals due to disease, infections, and infestations will increase. And those will be associated with significant economic impacts and on social security, the challenges. So we also want to reverse it. And about the environment benefits, so currently, as you can see, this map from Western Europe, some studies have shown that in the natural rivers, the antimicrobials are already widespread. The antimicrobial residuals are already widespread. And so this was already a region with very advanced AMR and AMU strategies, and they are reducing the use of antimicrobials significantly over the past decades. And they still observe this kind of widespread environment contamination. So we could imagine in areas in other parts of the world where antimicrobials are more intensively used, probably the situation will be even worse. And we also want to address this kind of challenge and to better protect our environment. And all those eventually link to the social economic benefits, because if we leave those problems unaddressed, our GDP eventually will reduce quite almost 10% in the worst scenario, as estimated by the World Bank. And then my last slide. So under the partnership platform, eventually, which will be launched in the World AMR Awareness Week this year, the global campaign will be placed as one of the action group under the partnership platform. So the aim of this is to better use the platform, the partnership platform, to advocate and mainstream resources to support the global campaign. And you are all very much welcome to join the partnership platform and join the campaign. So this is my last slide. Thank you very much.
Thank you very much, Dr. Yu, for a very comprehensive picture of what the FAO is planning, and it's a very, very multi-sectoral effort, as was obvious from the slides that you showed. You have everybody from governments to civil society to consumers, and public awareness means all the young participants who are here with us. And one of the reasons for this scientific poster competition is to bring out the ideas from our student communities or the young youth community on what they think could be done. And going by the long list of questions people have asked, there's a lot of interest. We don't have too much time to go into all the questions. We're nearing the end of the program today. But since this is an ongoing program, and for the scientific poster competition, we will be interacting with all the young people who are registered with us. We'll be interacting with them one-on-one also if necessary, but through some kind of common links where we'll put up answers to all your questions, provide other background material, and any kind of discussion, because the important thing is that everybody gets to understand what are the different issues involved and what are the different problems and challenges involved here. Today's discussion was primarily by way of introduction to the subject, really speaking. It'll be a slightly longer journey to get into some more depth, and we sincerely hope that all our young participants in the poster competition and in this dialogue will pursue this further. And we'll also be always there to help you with whatever information is needed or what you're interested in. So I will not go into additional questions at this stage. Some of the questions have been already answered by the presentation that have been made in the discussion previously. I will now invite Dr. Sujit Chandy, Head of React Asia Pacific, to give his closing remarks and also give us his view on the discussion that has happened so far. And maybe that will also answer some of the questions that our participants have put to us. Over to you, Dr. Sujit.
Thank you very much. And I'd just like to say that this is a very enlightening panel discussion and the presentation. The reason is that, all of us are in a different learning curve. Some of us are very familiar with some of these topics, and others for the first time. It's like an ABC. But whichever part of the learning curve, I think we must understand that time is of the essence. The antibiotic usage is still going up, though there are lots of efforts to contain it, both in the animal world, the agricultural world, as well as the human world. But is it enough? And are we doing enough? And that's where all of us listening to this conversation, it becomes important for us to assimilate what's going on in terms of knowledge, but also to understand the real urgency of why we are sitting and listening to this. And then not just that, but to move into some sort of action mode. And I do realize that you might ask yourself, okay, what can I do about it? But the fact is that each person is important when it comes to knowledge dissemination. And it is also important to understand that from a One Health aspect, especially, we do need to help our farmers. We do need to help those who are dependent on some of these things by practice or behavior. But for lack of alternatives or knowledge of lack of alternatives, they hesitate to change. And I think if we are able to do our own piece, either through communication or through advocacy or through research itself, and help, especially from our own local context, I think that's the most important thing. So I really like to thank all the four panelists, Dr. Kabali, Dr. Q, Dr. Sunil, and Dr. Philip for your comments. I'd also like to thank especially Dr. Q for that actually wonderful presentation, which put into a nutshell all that we have to do, the world has to do in the next few years, and I won't say even decades. I don't think we have that much time. I'd like to thank Satya for moderating the panel and this entire session, as well as like to thank Vishal and Shruti and other members of the RAP team for putting it together. Last but not the least, I'd like to thank all the participants who spend their time with us. As Satya said, this is just the beginning of the process. And we'd like to engage with all of you on a continuous basis. And we hope that all of us together can do something about AMR from a One Health approach. Thank you very much. And back to you, Satya, for your closing of the session. Thank you.
Thank you, Dr. Sujit, for the roundup of today's session. Thank you once again to all the panelists, our experts from the FAO, Dr. Sunil, Dr. Philip Matthew, for being here, for giving us valuable time, and more importantly, the very, very valuable insights. And I hope our participants are taking back a lot of ideas from this. And we will sort of wind up here. Any last words? Anybody wants to, Dr. Kabali, anything you would like to say? Last words?
Yeah. Well, the discussion is interesting, and the presentation from you tries to wrap the conversation up. I noticed a request if the slides will be shared, and I believe, Satya, you would be able to share that. But the importance of this collaboration and why we are supporting this work by REACT is exactly in the spirit of the campaign. Everyone is important. The ideas from the students to FAO matter a lot. And our commitment through this partnership with REACT is that whatever students who submit in the competition will already be concepts and ideas that we would like to take on the campaign. And if some of those ideas, whether they win a competition or not, are going to be used and upscaled, we are going to ensure as FAO that we bring the students that submit those concepts on board to acknowledge their intellectual property, but also to help them develop their own concepts depending on their career and their area of work. So I encourage colleagues, the student colleagues, to really think about this issue and take it personal, and see solutions that would make a difference in your own environment. I think in the presentation we saw that Asia's population is growing. Asia's meat consumption and demand is growing. We need real solutions to prevent AMR, but also to ensure that we provide food for our community. So thank you very much. With that, I close. Thank you.
Thank you very much, Dr. Kabali. Dr. Sunil, one last word, if I can. If you have anything to say. and then we'll wind it up. after.
I think I'll just quickly say that I think we had a wonderful discussion, though the time was a limiting factor, but still, what I would say that the students need to take it up. Students need to take it up, and probably not like we people, probably they'll come out out of the box solutions somewhere. And that is what we are looking at, probably the posters, because maybe some of those bright minds could give you some solutions to this, wherein that could click. And probably we are looking forward to that. We are looking forward. And thanks to all our panelists for React Asia for organizing such a wonderful program. Dr. Sujat also is here. Thank him for that. And Dr. Satya for a wonderful time, wonderfully moderating this session. Thank you. Thank you again.
Thank you, Dr. Sunil. I'll hand it back to Vishal. If there are any announcements from the organizers about the scientific poster competition or on follow-up, and then he can end the session. Over to you, Vishal.
Thank you, Satya, for that, for winding up the discussions for today. So looking at the interactions today, we see a lot of questions that have come in, and I think some of them are being answered in the Q&A chat box. So like Mr. Satya mentioned earlier, we'll try to get back to the participants individually in the coming days regarding your queries. And if you have any further queries regarding what we have discussed today or the competition, you can definitely mail us at consultant.aspic.in. We'll be just putting that in the chat box. If you have any further queries regarding the competition or what was discussed here today, that can be taken up with us over mail or otherwise during the coming days. So definitely, once again, want to thank everyone, all the panelists, our partners and participants for being here with us today. It has been a wonderful session. We take the time to thank everyone for being with us today, and hope to interact with you all in the coming days in regard to the competition. Hope you all had an informative and engaging session, and have a nice day. Thank you. Thank you all.
Thank you and bye.
Thanks and bye-bye. Thank you.
Thank you and bye-bye.